This webinar, The Spirit of Motivational Interviewing, was developed by the Integrated Employment Institute and is presented in partnership with Oaks Integrated Care. Today we will be introducing motivational interviewing as it relates to our role as providers in facilitating change. We will summarize the 4 aspects that make up the spirit of motivational interviewing. This is part of our first 4 Introduction to Career Service models. These are essentially teasers. They lay the foundation for skill development that will come in the work that we're doing ahead. In previous sessions, we discussed the complex process of making a change. This included defining readiness as an interest or willingness to engage in the process of goal-directed change, as well as critical factors that impact readiness. Let's review those factors for a moment before we move on. The first factor associated with change is felt need. This includes a willingness to work toward a goal, dissatisfaction with current life experience or role, and motivation. The next factor is commitment. This is someone's belief that change is both possible and positive for them. The third factor, external knowledge, refers to what someone knows about the environment they are seeking to be a part of. This could be education, employment, or other community-based roles. It includes the expectations and requirements of the job or educational program. The fourth factor is internal knowledge, and this is what one knows about themselves in a desired role. It includes your interests, values, and preferences that relate to employment and education. And finally, underscoring all of these factors is the importance of the therapeutic alliance. This therapeutic alliance and sense of partnership will frame our talk and our work in motivational interviewing. While MI might be new to some of you, as practitioners, change is our business. We work with people to set goals and to look ahead at how to make changes and get closer to the life that they want to lead. But we know that change isn't easy, whether it's for ourselves making changes or for the people that we're supporting in our program. Let's spend a moment on talking about why people who want to change might be hesitant to do so. Often when we're thinking about changes, we have a lot of contradictory thoughts and feelings. One day we might be really excited to make a change, and the next we get a little fearful or a little hesitant. When there's that back and forth, that's usually associated with the stage of ambivalence, or the state of having mixed or contradictory feelings about something. A person sees both the reasons to make the change, as well as the reasons not to make a change. Think about some of the changes that you've made. Think about the ambivalence that you might have had and you might have felt. How did you resolve that ambivalence? What were the reasons behind the change that you were making? What were reasons against it? This concept of talking about that change is referred to as change talk, which is what a person is saying or telling us in favor of the change. Now, on the other side of that, there's the term sustain talk, and that's when a person is using their own arguments for not changing. Sometimes what happens, though, is we see hesitation when there's a push-pull between what somebody is considering and what somebody else might want for them. So when others push for a change before the person is ready, or when others argue for one side of that change versus the other, it's kind of normal to dig our heels in and to be a little bit more hesitant to do so. One person pushing for a change might make us argue harder for the other end of it, or not changing. This is a typical part of the change process. And in motivational interviewing, we want to listen for talk both ways. Both the sustained talk and the change talk are expressions of ambivalence, and ambivalence is progress toward making a change. As a provider, you may have had expertise in behavior change, in mental health, but there is little that you can do to make someone change. You don't have to make the change happen. You can't. What we can do is help a person to better understand their own motivations for the change, but know that we cannot make the change happen. We don't have to have all the answers. We want to help elicit those answers from the person. We want to uncover what they know and help them to see themselves in an expert role. The person making the change is the expert, and we are there to help guide them. You see on the bottom here, it says you're not wrestling, you're dancing. In the motivational interviewing approach, it's a dance instead of headbutting or wrestling. We want to be able to help guide a person, work together in partnership. And this metaphor really articulates that we're working as partners in the process of change. When we're able to partner with somebody, we're able to avoid that headbutting, that conflict, that back and forth, or creating that sense of digging in your heels when you don't want to do something. In motivational interviewing, the provider doesn't try to make things right and doesn't try to change the person's behavior. Change comes from the person's intrinsic motivation. You see the quote on the slide here. A person's own reason to change, not yours, will motivate behavior. We have to acknowledge that the righting reflex is present. We often want to correct or to modify behaviors. And we want to try to actively ask ourselves to override that instinct. And that's something really unique to motivational interviewing. There's a brief audio clip on this page. I want you to go ahead and pause this recording and spend 2 minutes to listen to that. And this comes from the Center for Evidence-Based Practice at Case Western. And they really nicely describe the righting reflex and its relationship to that hesitancy in the change process, right? That ambivalence and sustained talk. After you listen to the clip, I want you to consider, how was the righting reflex described in the clip? And what did this person do to override the reflex that the person is referring to? So now that we've laid some of the foundation, I want to introduce what motivational interviewing is and get into the spirit. So motivational interviewing is an evidence-based treatment that addresses ambivalence to change. And remember that ambivalence is a natural part of the change process that all of us experience. Motivational interviewing is a collaborative conversational approach to help people examine their ambivalence, express the desire to change in their own words, and that's the change talk, enhance their confidence in taking action, elicit and strengthen change talk, strengthen commitment to change, and plan for and begin conversations around change. For some people, the rest of the session will be a refresher, while for others it might be new. If you are trained in MI, when you go back to your team, please try to support your colleagues in growing their knowledge and skills of motivational interviewing. As we begin our discussion on the elements that comprise the spirit of motivational interviewing, let's take some time to identify what MI is not. Motivational interviewing is not just being nice to people. And it is not the absence of assessment or feedback. It's not the stages of change, though it's often connected to the stages of change, and we talk about them in tandem. It's not firing people up to change and just being a cheerleader. And it's not a cure-all. So it doesn't mean that just because you're practicing motivational interviewing, that the person's behavior is automatically going to change or they're suddenly going to adopt new behaviors. This is a process that takes time. And motivational interviewing is not tricking people into changing. It's helping them to develop their insight and explore and resolve their ambivalence. We are providing additional knowledge, resources, and support to do so. So that we know that there are different styles of counseling and different styles of communication. In motivational interviewing, practitioners typically fall in the middle of the continuum between directing and following. We take a guiding style. So it doesn't mean that there's an absence of feedback given. It doesn't mean that there's an absence of assessment. It simply means that we're taking the person's lead. We're allowing them to be the expert and to partner with us in their change process. The spirit of motivational interviewing is the heart set and the mindset in which all MI techniques are filtered through. When these 4 key elements of partnership, acceptance, compassion, and evocation are reflected by a practitioner, only then are the services that are offered considered true motivational interviewing. There's a 1.5-minute audio clip on this page. I would like you to pause now and listen to that clip by Dr. De Los Reyes from the Center of Evidence-Based Practices as she discusses the spirit of motivational interviewing. After listening to the clip, I want you to ask yourself, was this surprising? How was this way of engaging different than ways I may have engaged in the past? What could be the benefits of using this type of approach or style with some of the people that I'm working with? The first component of the spirit of motivational interviewing involves partnership. The main piece of building partnership is one's ability to avoid entering the role of expert advice giver. This is a collaboration between experts. We want to avoid the pitfall of presuming to know more about what's best for the person. The therapeutic relationship should be referred to and thought of as a partnership and introduced that way to the individual. We want exploration of change without interjection of our own values, beliefs, and needs. We want to help the individual explore their values, beliefs, and needs, while continuing to self-assess if ours are getting in the way. Motivational interviewing is also done with a person, not to a person. This partnership honors the person as the expert in their own life, and it emphasizes the development of the person's own motivation to change. So what does partnership look like from your personal experience or from your work? Consider the quote on the slide by Dr. Amador. Why would anyone want to listen to you if he felt you had not listened to him first? Consider the characteristics of the person that you identify, that you think about as someone who has helped support your change process. How did they partner with you? In what ways did they support you? And what did it feel like to have a partner rather than someone pulling you along? The next component of the spirit of motivational interviewing is acceptance. A practitioner exhibiting acceptance would demonstrate unconditional positive regard and be non-possessive. They honor each individual's absolute worth and their potential for growth. They recognize and respect the autonomy of individuals. This means that they also have the ability to choose, and that means consequences as well. We show an active interest in the person and in their narrative. There's an attempt to understand the person's perspective and demonstrate this understanding with accurate empathy. And then we actively seek out opportunities to affirm the person's effort and their strengths. Carl Rogers describes unconditional positive regard as supporting and accepting the person as they are, regardless of what the person says or does. Who in your life does this for you? And what does that allow you to do? The third component of motivational interviewing is compassion. Compassion is a deliberate commitment to pursue the welfare and best interest of the other. This promotion of others' welfare is one motivation that draws people into the helping profession. The Merriam-Webster's definition of compassion is sympathetic consciousness of others' distress together with a desire to alleviate it. Compassion in motivational interviewing refers to the needs being first and foremost in any MI session and your relationship with the person. It's often easy to focus on a person's deficits or difficult behaviors. However, when providers come to a session or the relationship with the person from a place and perspective of compassion, the focus becomes more strength-based, and we look for positive qualities of the individual. Reciprocally, looking at the person's strengths and positive qualities first and foremost can help us to better develop compassion. Compassion is conveyed in how we communicate verbally and non-verbally. For example, when we make eye contact or keep our body turned toward the person when they're speaking, when we're listening quietly. Practicing active listening, which involves paraphrasing or reflecting, asking open-ended questions, all of these types of things send the message that you're ready to hear more, that you want to hear more. We will be covering some of those things in more detail in future sessions. We ultimately want the person to feel that we are prioritizing their needs, feelings, and experiences, and we're demonstrating that by the use of empathy. What does compassion look like to you? What does a lack of compassion look like? Can you think of examples in your own life when you felt that people conveyed that compassion? The final component of the spirit of motivational interviewing is evocation. When we're thinking about how to help people evoke, we want to partner with them to be able to allow them to come up with their reasons for change. Note the quote on the slide. People are generally better persuaded by the reasons which they have themselves discovered than by those which have come to the minds of others. Consider your own changes. What was this process of change like for you? What persuaded you to change? Was it your own internal desires, urgency, pressure, or did it come from an external place? When thinking about evocation, we also need to consider the role of ambivalence. Ambivalence is typically debated by your internal committee, right? Typically, it's this silent process that goes on in our head and in our background as we're weighing some of those pros and cons of change. This process is easily derailed. It's derailed because people outside might voice pros and cons equally. And that just continues to result in more ambivalence. In using the spirit of evoking, we can help people to continue to move throughout the process of change by helping them to explore their change talk. It's externalizing that internal process. Also consider when evoking someone's motivation to change, what it means when sharing it with another person. Being able to verbalize these things often strengthens commitment and better helps people to resolve reasons for not changing. When a provider listens and does not offer their ideas on the reasons for change or against it, and it's coming from the person, that can be a powerful shift. The use of open-ended questions will really be able to help to guide this conversation and help evoke from the individual their reasons for change. In motivational interviewing, we are literally supporting an individual to talk themselves into changing using their own words and their own reasons, because we know that people tend to be more committed to what they hear themselves say. Consider for a moment, what are some of the open-ended questions that you use to help elicit information from the people that you're working with? This concludes our session on the spirit of motivational interviewing. If you have any questions or comments or would like additional information, please feel free to contact us. We've included resources and references on the slide here. The audio files can be found at the link on this slide, as well as throughout the PowerPoint.